So my name is Charmaine Enns. I'm the medical health officer or the public health doctor for the North Island. So that means Comox Valley up. And I've been your public health doctor for the last 15 years. So my job is one of my jobs is to report on health impacts at a population level, sometimes at individual levels, but mainly at a population level, and that's what I'm here tonight, is to be able to speak to the health impacts of air quality and, before I'm done, get quite specific about Woodsmoke. So I'm going to start big and go small. So we don't need Einstein to actually understand how come air matters. We all have lungs and we all have to breathe. So I don't want it to, some of it does get a little complicated, but where we need to start is really not that complicated. We all breathe. So we're all impacted by air and by what's in that air. So when you look at pollutants that are in the air, that means everyone who's breathing is going to be exposed to it. So no one is unaffected, even though you might feel unaffected. The reality is if you're breathing air with a lot of pollutants, you will be impacted. So when you have large populations of people exposed, that means, well, everyone isn't going to have the same outcomes. Because everyone is exposed, you're going to have higher rates of disease related to that specific exposure. We call that population attributable risk. So that's the proportion of disease that's impacted by a specific exposure. When everyone is exposed to the particular exposure, which in this case we're talking about poor air quality or pollutants in air, that means you're ultimately going to have a large number of people impacted. This is particularly true for air because it's not just one negative health outcome that comes from poor air. It impacts a lot of different disease processes. So I'm going to start big, global. So when you look at the whole planet, 92% of the world lives in places, 92% of the world's population lives in places where the ambient air quality exceeds the WHO or the World Health Organization standards. And the WHO standard for annual ambient air is 10 micrograms per meters cubed. That's a little bit higher than what ours, but you can see it's 8. Provincially it's 8. Canada-wide is 10, BC is 8. So 92% of the world, that's a lot of people. When you look at how many people die from that, the WHO estimates 3 million deaths annually. That's 5.4% of all deaths are directly attributed to poor air. I just wanted to put this up to put in context about indoor air. When you look, so that's outdoor air results in 3 million deaths. Bad indoor air results in 4.3 million deaths. That's 7.7%. I wanted to just bring that up from an equity perspective because of those indoor air deaths, by far, most of them are women and children. So this is in where women and children are exposed to bad indoor air, cooking with wood and coal, and being in places that are unventilated, and they are the ones who are carrying the burden of poor indoor air. I always have to put in my plug for the global perspective. So when you look at the rates of death due to poor indoor and outdoor air combined, that the darker the color, the higher the impact or the death rate from that air, either indoor or outdoor. So again, I just wanted to put some global perspective. Okay, next one. So when we look at air pollution, I'm going to talk about air pollution generally. So air pollution is, and when I talk about air quality and air pollution, we're talking about a number of different potential pollutants in that air. Particulate matter is the major pollutant that we're talking about tonight. But particulate matter is also in air pollution, as is nitrogen dioxide, as is sulfur dioxide, as is ozone. So when you look generally at air pollution, on the days that there's worse air, everything else being equal, more people will die. When the air gets bad, more people die. Bottom line. When you look at cities that are polluted, the cities that are more polluted compared to the cities that are less polluted, with everything else being equal, more people die in the more polluted cities. If you look within a city, within regions of a city, where there's areas that are less polluted compared to areas that are more polluted, the areas that are more polluted, even within the same city, will have more people dying, like everything else. Okay, next slide. So air pollution matters. What's in the air matters. And there are now thousands of studies that have the evidence that what you breathe matters. So I think if we try to I don't think anybody's arguing that air matters and that bad air or pollutants in air affect our health, because that would be like arguing that cigarettes don't impact your health. So we're way past having to find evidence that air matters and that air pollution impacts your health. So we're not just looking now. Now the science is getting down to what else does it contribute to that we didn't actually realize specifically. So we know how much air pollution impacts cardiovascular health. We know how much it impacts respiratory health. And all those things that are listed there in red have been proven over and over again as direct correlation to bad air. We have a shorter life expectancy, higher likelihood of stroke, higher likelihood of heart disease, increased asthma, lung cancer, reduced lung function. This is really important for children, of course, with their growing bodies and their developing systems, low birth weight babies. And now, though, we have a lot more evidence and association that we'll need more evidence for everybody to be able to say with a lot of conclusion that is also having an impact on other systems that we hadn't thought about before, like your ability to learn, Alzheimer's, depression, obesity, birth defects, diabetes. There is now increasing evidence about how air quality and poor air and the pollutants in the air are also impacting those aspects of your health. Okay, next one. So this is just to show, sorry, this is really difficult to see, but on this axis going up and down, it talks about different risk factors, and how it contributes to death rates in Canada. The highest one is dietary risk, so what you eat. And then next it goes tobacco. And the list goes down. And then air pollution is in the red box. So air pollution is not a small matter, even in Canada. And this is thanks to Dr. Michael Brower. And he estimated that in Canada, particulate matter, that specific pollutant in air, contributes to over almost 9,000 deaths annually in Canada. And if you look at it just for BC, it's over 1,100 deaths per year in the province directly related to particulate matter, especially the fine particulate matter. Okay, next. So what is PM 2.5, which is the guy in the room we're all talking about tonight? So that's particulate matter, and that's what PM stands for. The 2.5 refers to micron, or the size of the particle. So the size of that particle is those red circles. So that is a piece of human hair, which is 50 to 70 microns in diameter. And this is just to put into context how small that particle is. So you could have 20 to 30 of those PM 2.5s before you get across a diameter of hair. That's how fine it is. Why is that important? Because these are complex particles. They're made up of solid and liquid particles can have different constituents depending on where they came from. Inevitably, PM 2.5 comes from a combustion process of some sort. And because of its size, that means you can breathe it in deep into the smallest places of your lungs. So the smallest place in your lungs is called the alveoli, which is this tiny little air pocket at the end of all the branches in your airway. And they go right down to the alveoli, which is important because that's right up against our blood supply system and where oxygen is exchanged. So PM 2.5 is especially problematic for those two systems that I referred to, heart disease and lung disease. And I just want to put in context because you can breathe it all in and it goes down to the smallest airways. That means there is no safe level of PM 2.5. So it's not like anyone can say, if you breathe only this much fine particles, you'll be fine. We can't do that. The fact is any exposure there is no safe level. But that doesn't mean we're not going to breathe particles because we have to keep breathing. So the next to now. So what's the effect of these fine particles? So There is a notion that it's the lungs that are going to be most impacted because we're breathing. But in fact, the system that is the most impacted is the cardiovascular system. So heart attacks, stroke. Those are the two biggest and the most common outcomes from exposure to particulate matter. And the worst outcomes are with chronic exposure over time. So it accelerates disease processes that might not have otherwise resulted in negative outcomes. But the effect of PM 2.5, you breathe it in, goes into those small airways. It has a number of different ways it can do its work. It can have a direct effect on the lining of the small airways or on the lining of the lungs. It can have an indirect effect, but most of the effect is through an inflammatory response. So it can cause inflammation either directly in the lungs, so you have like your asthma flares up, or it makes your COPD worse, or but it doesn't just do that. It more commonly goes into the blood supply, either directly or indirectly, because it can actually, because the particles are so small, it can literally go through the lining of the lungs into the blood supply. It can go into your lymphatic system, so into your lymph node system. It can dissolve or break down in the lungs so that the chemicals that are in that particle then get absorbed directly into the bloodstream and then directly into the lymph system. There's a number of different mechanisms by which the particles do their job, but what I want to leave with you all is that it's an inflammatory response. It results in an inflammatory response, and it's not just about your lungs, it can go through your whole body. And that's how heart disease happens from being exposed to PM 2.5. It's also the immune system that is impacted, and it stresses out our immune cells so that they don't function like they're supposed to, and that's part of the inflammatory response. So when we're looking at all those other disease types, or disease outcomes, we talked about diabetes, dementia, depression, the theory or the causal mechanism behind all of those keeps coming back to inflammation in that inflammatory response. Okay, the next one, Jim. So this is a bit complicated. Again, I just want to give you the gist. This is looking at the amount of asthma that's distributed in the Comox Valley. That was for this year, looking at December 29 to February 23rd. I actually just got these today. So the top graph is the normal amount of asthma that's dispensed from pharmacies in the Comox Valley on each day of the week. And the bottom is the air quality monitoring station with the PM 2.5 levels. And so you can see there tends to be a correlation, or as after the PM 2.5 goes up, there's more Ventolin being distributed. The one beside it is visits to the doctor, again from January 6th to March 3rd, again for 2018. And how you can see how the doctor visits, the yellow bars, go up higher than what you would normally expect after those peaks in PM 2.5. You have to sit and look at it closer, but if you could just trust me on this, that would be great. But if not, we can have more discussion later. Okay, next one. So where does particulate matter come from? Seeing as this is the pollutant that we're most interested in. Well, oh shoot. I put biomass in red and I kind of made it disappear. So I just wanted you to see that it's either man-made or natural. Most of it's man-made, and it all comes from a combustion process of some kind. So either from combustion engines, from solid fuels, so burning coal, heavy oils, and then what's in red that you can't see is biomass, so burning wood. Industrial activities, and then there's secondary particles that form in the air, but those particles come from a combustion process, from combustion of sulfate-containing fuels. And then there's natural, desert dust, which we don't have, and traffic-generated dust. Next one. So biomass burning. So there's different sources for biomass, wood burning. You all know this stuff. It's coming from the chimney, it's wildfires, it's agricultural or the burning, the agricultural burning, there's the backyard burning. And then I just want to put it in context that there's the tobacco. It is also biomass and it's being burned. And it is actually closely correlated with the chemicals that come out of wood burning. So when you look at what comes out of wood smoke, the chemicals in wood smoke, and compare it to the chemicals in tobacco, this one on the right shows all the chemicals that are found in both wood smoke and tobacco smoke, and I'll just name a couple: formaldehyde, benzene, toluene, lead. So it's not a benign mixture of chemicals that's coming out of wood smoke. So those particles, which now everybody potentially is exposed to, is breathed into the small airways of everybody's lungs. Okay, next one, Janelle. So what are the health effects from wood smoke? So a lot of the studies about PM, particulate matter, have been done in large cities, metropolitan centers, and the association with and the correlation between health effects and PM, particulate matter, fine particulate matter, has really been about PM 2.5 from traffic sources, because they have large volumes of traffic and a lot of pollutants from the combustion of driving vehicles. So we're only starting to get some evidence in the last 5 to 7 years where there's some association specifically to wood smoke, because we haven't been able to separate out where all those particles are coming from, those fine particles. So it's now we have supporting evidence that wood smoke's affects heart health. We'll give you the reference. That there's increased risk of physician. This is a BC study that actually found wood smoke increased the likelihood that children are going to have to go see a doctor for an ear infection. That was done in BC. We have another BC study that showed wood smoke was increased with infants getting bronchiolitis. That's a really serious infection of the inflammation of the upper airways. And then there's a large study in California that was just done in 2012 with PM 2.5 from biomass from burning wood. So we don't have a whole lot of specific related to wood smoke, but PM 2.5 absolutely. But this is the good thing. We now have a study specifically done that was done in the Comox Valley that I think really adds to the body of literature and what it means to breathe fine particulates that come from the burning of wood. So this is a Health Canada study. I just want to put it up here because it's relevant to our discussion tonight. Scott Wichenthal was here in the spring last year to speak to the elected officials on the study and the findings of the study and how the wood smoke that was generated here in the Comox Valley did have a negative health impact. So I'll just explain. The study, because most of the large body of volume looking at the effects of particulate matter have been done in large urban centers, this was the first study that looked for non-major urban centers. This was looking at smaller cities or smaller areas that had a higher proportion of wood smoke. So there's a lot of evidence that these three cities, Prince George, Kamloops, and Courtenay, Comox, that their PM 2.5 is coming from wood smoke. It's not from industrial. We don't have a lot of traffic. We know from the monitoring station that in fact those other pollutants aren't contributing to the air pollution. It's really particulate matter, and without any other source of the particulate matter except wood smoke, this was a logical community to pick for this Health Canada study, as was Prince George and Kamloops. And the question was, does biomass burning, does the particulate matter that comes from burning wood, is that associated with heart attacks? Because we've been able to show that with traffic, PM 2.5, but does wood particulate matter do that? So this study looked at air quality sites in 8 different locations in Comox and Courtenay, and you can see they're numbered 1 to 8. Those were fixed sites that looked at the air quality over a period of time. To make sure that, and then they correlated it with what's coming out of the air quality monitoring station. Okay, next one. I'm not going to go into the details of all the details of the study because we don't have time for that tonight. But the findings were that for every 5 micrograms of a particulate matter that was associated with wood smoke, because they actually monitored for something called levoglucosan, which is specific to wood smoke. So it wasn't just particulate matter, they looked at all particulate matter, and then they looked at the specific marker, and they could tell that the majority of particulate matter came from wood smoke because of looking for that specific marker that only comes from combustion of wood. And they were able to demonstrate in that study that between 2008 and 2015, that for every 5 microgram increase over 3 days average, there was a 6% increase in heart attacks in people over the age of 65. And the more wood that was burned, so that the higher the PM 2.5 that came from wood smoke, the higher the likelihood of having a heart attack for that age group over 65. And in fact, it got up to 19%. So your likelihood of having a heart attack with high exposures to PM 2.5 over a 3-day period, that's not insignificant. That's a significant impact on heart health. So in summary, there is no safe limit for air pollution, but any improvement in air quality will result in reduced health impacts. So this isn't about zero particulate matter. We will never get zero particulate matter. That's not possible. That's not reasonable. That's no point in talking about that. But any improvements we can make in air quality will have an improvement on health across the population. So the lower that PM 2.5 is, the better especially it will be for heart disease and respiratory health, both in the long term and in the short term. And we have the technology to reduce particulate air pollution. So it's an opportunity and it's something we can do something about. And that's what I wanted to say.